Welcome to the CNS Podcast featuring Dr. Daryl Inaba, Research Director for CNS Productions.
In spite of a lot of, good results and a lot more support for harm reduction, it's always and continues to remain a controversial issue, and probably one of the most controversial issues with harm reduction is the needle exchange issue and the distribution of Narcan to help addicts reverse overdoses within themselves. Part of the controversy is that it seems that many of the people who are participating or who are administering these programs and helping to distribute needles have actually become addicted themselves, or may have been addicted before and gotten into this and are just promoting or perpetuating their addiction. There certainly does seem to be a number of deaths in many cities like San Francisco, New York, and Chicago of people who are part of the needle exchange and the Narcan distribution community. The other controversy is that needle exchange is probably the wrong term. As far as I've seen in various needle exchange programs, it's not so much exchange as it's needle distribution. It's not replacing one needle for needle as an addict turns in ones that they've used, and you give them a fresh one so that you don't increase the needles that are out there in the street and on the community. What really seems to be working best from the harm reduction point of view is huge distribution, giving 50, 100 needles at a time to addicts so that they have an end of supply to be able to administer the drugs. The other big controversy I have is that there needs to be a greater consideration of the addiction itself, and that needle exchange and these types of harm reduction behaviors should recognize that the greatest harm reduction thing that could ever be done is to provide treatment on demand. If somebody, an addict, decides they want to get treatment, if they can access and immediately get into treatment, that's the best thing we can do to reduce harm from addiction. And so many of the exchanges and the harm reduction programs, part of their mission is to not address the addiction at all, not to talk about it, and not to promote that people take a look at their addiction and get into treatment. And I think that's a big mistake. When you look and step back from all of this controversy and look at what harm reduction was trying to do, and that was trying to decrease, first of all, when it came about, was looking at the HIV and the spread of AIDS, and especially needle-transmitted diseases as well as AIDS. If we look at the data on that, I think it's pretty clear that harm reduction has been effective in really decreasing the spread of AIDS and other needle-transmitted diseases. The next approach with these exchange programs, or the harm reduction in terms of needle exchange, was to provide Narcan and teach addicts how to administer it to a friend if they're overdose. And when we look at the data from that, it seems like that's been effective as well. There's been, despite these overdoses of people working in the needle exchange and programs like that, there has been an actual decrease in overdose deaths around the country. So from the point of view of harm reduction, certainly these are working. From the point of view of addiction, if an addict continues to use drugs, as far as I've seen throughout my 40 years of working with addiction, the addiction doesn't abate. It actually progresses and gets worse and worse. And if that's a situation when you're working with an individual who's not getting any better or maintaining or not having as much illnesses or something, but they seem to get worse and worse in their addiction, I'm not sure that's harm reduction. And I'd like to see us invest a lot more in trying to think of another harm reduction strategy as basically doing just treatment on demand.
That wraps our pod for today. Thanks for visiting the CNS Podcast. Please check back soon for the next in the series and visit our website, www.cnsproductions.com.